Okay, one of the biggest misunderstandings about sciatica is what's causing it. Our sciatic problems with the biggest nerve in our body that leaves our back and goes down our legs. If we're having numbness or tingling or any loss of strength and coordination, what's happening is oftentimes as we dive into this point, I'll stop it right there. These spinal discs that are in our back that sit between our bones, there's a middle here that's like a piece of jelly that is encapsulated in these kind of rough fibers that keep it intact. And so when these start to have problems, those discs will push back, those hit the nerves that lead from our spinal cord down into our legs. And what most people can correlate is that they may have pain and numbness and things that are related to sensory, but it's not always often coordinated with the muscle contraction. So coordination, function, just the balance and giving out. A lot of people, when they're having this type of disc problem, sciatica itself is almost the lesser of the two evils. It starts to mess with function and pressure on the nerve. So one of the opportunities to address it, this is one of the best methods to non-surgically approach how do we fix sciatic issues. So the type of decompression we use, as this illustrates, has been studied by multiple professional universities and very competent places, but the integrity of what it's doing, the type of treatment we use, it'll take the pressure in these disc spaces and it reduces them. And basically it does that in such a way, as this will illustrate, that in the nucleus here, or this kind of piece of jelly, it'll actually invert, it actually depressurizes it, creates a vacuum and sucks the disc material back in. And when it does that, you can see the hydration following it, it actually starts to heal up the disc. So there's lots of these kind of before decompression, after decompression, where this little blob right here, which is this fragment right there, that little blob is where it's going to hit the nerve. As soon as that is off the nerve, your symptoms are gone because the disc itself doesn't have a nerve to it. And the coolest thing is that after enough repetitions, the disc actually heals up in such a way that it stays healed. So this isn't something you've got to do forever. This is something that once you get from point A to point B, it's a completed, fixed issue that will age with you normally. Success rate is very, very high. We've worked with thousands of patients, and it's heaven sent for us dealing with really tough spinal disc problems, especially sciatica.